Hi, it's Sandy, your rec center dietitian, and I just want to welcome you to our class today. It is on understanding inflammation. So let's get started. So inflammation is kind of the 21st century buzzword in the medical field, in the medical community, because it's believed that a lot of disease now all stems from the issue of having inflammation in the body. So as you can see, diabetes is out there along with neurological diseases, depression, autoimmune disease like celiac, Crohn's, there's hundreds of different autoimmune diseases, cerebrovascular, so strokes, those type of events, arthritis, neuropathy, which is also linked to diabetes, having pain in the nerves, in the smaller vessels, the feet, the hands, pulmonary disease, diseases of the lung, Alzheimer's disease, which they sometimes call diabetes type 3 because all the inflammation and the high blood sugar can certainly contribute to that development of dementia later in life. Cardiovascular disease, we've discussed how having thicker blood or sugary blood can lay down that plaque and cause a higher risk of cardiovascular disease if you do have diabetes. Renal disease, which can be a long-term consequence of diabetes or high blood pressure, certainly. And then ocular diseases. We know diseases related to the eyes are also more common with people who have diabetes because those little vessels, again, get plugged up with sugar and the plaques that lay down in those. So if you think about your body and inflammation, inflammation can be a good thing if it's acute. So say you cut yourself, you break an arm, you have all these cells in your body traveling to that area. Maybe you get some pain and redness and swelling, and that's usually a sign to you or indication to you that it's time to take it easy on that area of the body. But what we're discussing is when inflammation becomes chronic in the body. So some of the causes or reasons that you might have inflammation in the body would be untreated infections or injuries that become infected, autoimmune disorders, long-term exposure to irritants. Those could be things that you're taking into your body through the diet, maybe through smoking or alcohol, or things that you're also getting in your environment, pollution, chemicals, other things that might be affecting you as well. Also, chronic stress is a big contributor to inflammation in the body. So if you went to the doctor, some of the inflammatory markers that they might be checking to see where you're at would be, the most common would be that CRP or that C-reactive protein. So it's a very reliable indicator of systemic inflammation in the body. So when you do have a doctor's appointment, you may request to have that marker checked to see where you're at. But there are some other ones that they will also use. The ESR, it's a little bit more specific. So can kind of go into a little deeper where that inflammation might be in the body or what might be causing it. And the PCT or the procalcitonin test has increased sensitivity to if it's a bacteria or infection or maybe a specific type of autoimmune disorder. So depending on what your doctor's looking for, they might go in a little deeper, do a different test. But if you want to request a test, the CRP would generally be the one that you might ask for. So ways to reduce inflammation in the body, you can certainly use NSAIDs or those non-steroidal drugs, such as aspirin, ibuprofen, naproxen. So those can help reduce inflammation and pain short term, but long term, they've been linked to some conditions such as ulcers and also kidney disease. So never a good idea to be on these type of NSAIDs for the long term. So always talking to your doctor if you feel like you need something for pain or inflammation to see if there's maybe a better choice for you. Steroids, corticosteroids can decrease inflammation. They also suppress your immune system. So that's not always a good thing if you're trying to fight off bacteria or infections or viruses. So that's another thing that you may not want to do long term, but it can help short term and preventing something that's going on from attacking that healthy tissue in your body. But long term can lead to vision problems, high blood pressure, and osteoporosis. So always talk to your doctor about, the risk reward there to using steroids. Supplements might be an option. Fish oil, lipoic acid, curcumin, or the active ingredient in turmeric have all been linked to helping to decrease inflammation in the body. And there's also several spices, including ginger, garlic, and cayenne pepper. So those could be some strategies that you might use, adding those spices to foods, or you can also find those in supplement forms. But you might want to have a measure of your CRP taken, that C-reactive protein, to determine whether you might need to use some supplements to help reduce the inflammation in your body. And certainly one of the things we can all do is make those lifestyle changes. So losing weight if your doctor recommends it, increasing that physical activity, which is good for so many other things, not just weight loss, but keeping things moving through your system, helping to produce some of those feel-good hormones as well. Just overall benefits to working out and staying active. And then also that low glycemic diet. So reducing carb in the diet and reducing that saturated fat intake. Those have all been shown to help reduce inflammation in the body. So some anti-inflammatory diet ideas, foods to eat, olive oil. We know that's a big part of the Mediterranean diet. Leafy greens like kale and spinach, tomatoes are anti-inflammatory. Fatty fish that contain those omega-3s, so salmon. We've got recipes in our meal plans that include salmon, if you like sardines, or mackerel, black cod or sablefish. Those are all great sources of those omega-3s. Nuts are another great way to help reduce inflammation in the body, unless of course you have allergies to them, so then you want to be careful. And then fruits, cherries, tart cherry juice, you may have heard of that. Blueberries, they're rich in fiber as well, have lots of antioxidants, anthocyanins that give them their blue color. And then oranges and citrus fruit are also very anti-inflammatory to the body. So the foods you want to try to stay away from would be more of those refined carbohydrates. So your white breads and rolls, your cakes, your cookies that are made with white flour. Fried foods, so going out to the restaurant, trying to stay away from foods that are fried, such as French fries, those deep fried mushrooms and cauliflower, those type of things. And having a healthier, choosing something healthier on the menu. Sugary drinks, so definitely regular soda. I don't recommend diet sodas though either because of the artificial sweeteners. Thinking about your coffee in the morning, not adding too much sugar or cream, that type of thing to it. Maybe a little bit's fine. And then staying away from those red and processed meats. They use nitrates, which are generally good if they're found in fruits and vegetables, in the process of preserving meats. But what happens with the meat is those nitrates form and join with the amino acids in the meat, and they form nitrosamines. And those have been linked to inflammation and even to colon cancer in our guts. So just trying to be aware and not trying to eat too many of those processed meats, those cold cuts, sausages, bacon, that type of thing. We also know that margarine, shortening, and lard, those saturated fats, animal fats, and the margarine, which is a trans fat, partially hydrogenated oil, those can lead to inflammation in our system. So trying to choose healthier fats, such as our olive oils, our olives, our avocados, our fatty fish and nuts and seeds, those can all be much better choices. And then again, as I mentioned with nuts, if you are allergic to any certain foods or suspect that you have an allergy to those foods, you would probably want to stay away from them, or maybe have some type of testing done to confirm, because any of those foods that you put in your system that your body does not respond well to, in the form of having an actual allergy, will contribute to inflammation in your body. And I just wanted to add one more slide here. We did mention chronic stress and how that contributes to inflammation in the body. So there's been a lot of just positive findings when you talk about getting family, or even, friends that you consider family, having that support from them if you have been diagnosed with disease or you have inflammation in your body. So they found strong associations with family cohesion and guidance with better glycemic control. So if the family's on the same page and they're supporting you, that's going to work for much better outcomes for you. Also, if you have a partner or spouse that supports you, that helps much in trying to make sure you're getting to your appointments regularly, take your medication, and do all those activities and lifestyle changes that you need to make. So support there can be very helpful. Living with others versus living alone. And this was even found if you're in a retirement community or that type, that helps increase your behavioral compliance and those outcomes. So some of the difficulties that people find are when family members want to eat different from you. That's very challenging for the person that has diabetes or has inflammation or other disease that they're trying to combat, to have those unhealthier foods around them, tempting them. So if you can get the whole family on the same page to support you, that's very helpful. If you have people that are constantly on your case to change your diet or change your lifestyle, that can also cause more stress. So trying to make those decisions on your own and stick with those decisions so you don't have those family members, well-meaning or otherwise, talking to you or nagging you to make changes. And then again, if you can't get the whole family on the same page, that's just so important when you're trying to support somebody with a challenging disease, is getting all the members of the family on the same page, so you don't have one child telling you to do one thing and another child trying to tell you to do other things that are contradictory. That just causes more stress for you. So trying to make sure everyone stays on the same page, and being direct with those people who aren't really helping you, and just telling them, you've got your plan, you've worked it out with your doctor, with your dietitian, and it's working for you. You've seen good changes, so you don't necessarily need a lot of other people making suggestions for you. So that's all I have today. I appreciate you joining, and I'll see you next time.